For the past 3 months, Margaret Drawson has had to learn to live without her husband of 62 years by her side.
There's one of our 50th wedding anniversary and one of our...
Gordon Drawson's health started to deteriorate 3 years ago, and until recently, she managed to look after him at home. Gordon was a Winnipeg firefighter for decades and retired in 1995 as a district chief. In August, he started having mobility issues and ended up in hospital waiting to get into a nursing home. It took 3 months for a bed to become available.
It's very difficult.
And even though it was beyond the Drawsons' control, the province charged them $101 a day, the maximum amount allowed.
I think the mistake they're making, or the problem, is when you start to pay at the hospital, you pay the same as you pay at the nursing home, and there is nothing going on there. At least at the nursing home, there's activities.
Margaret Drawson is 83. Every day she drove 20 minutes to visit her husband in Pinawa. She says he spent his time in bed, so she would wheel him to the common room for a change of scenery. That's the extent of the activity he got in hospital. And yet, she was billed $2,600 for his stay. And she's one of the lucky ones. There are some Manitobans waiting 6 months or longer for a care home bed.
There are about 341 Manitobans who are currently in hospital waiting for a bed to open up in a nursing home. Once the province determines a person needs to be in a personal care home, it begins charging people in hospital as if they're already in the care home, even if there isn't a bed available for them.
In the past 3 years, Manitobans have paid more than $15 million in residential fees while waiting to be transferred from hospital to a care home bed. That's according to figures obtained by CBC News through Freedom of Information requests. The problem is particularly bad in rural Manitoba. The data shows people living in rural communities were charged over $13 million compared to $1.8 million billed to Winnipeg patients. Dr. Michel Bruno is a family doctor in Lac du Bonny. He says it's unfair to charge seniors for taking up space in hospital when they have no other choice.
To me, it's so wrong on so many different levels. In the nursing home, when patients get charged for the care there, they actually get a lot of programming. They get a recreational person who just gives them more enrichment and fulfillment in their life in the nursing home. They don't get that in hospital.
He says it's not uncommon to find half the patients of a 20-bed rural hospital are waiting for long-term care.
If you're in hospital...
Laura Tamblin-Watts is the CEO of the seniors advocacy organization CanAge. She says this practice is happening across Canada.
Nobody stays in hospital for fun. You are only in hospital because you are desperately needing health care. And nobody there wants to take up a bed that somebody needs for an acute care like a heart attack or a broken leg. What we see here is the fault of a system being levied on individual vulnerable people.
Under the Canada Health Act, hospitals are allowed to charge for accommodation and living assistance services if a person is no longer receiving active medical care and is awaiting transfer to long-term care. Manitoba's health minister understands people's frustrations, but wouldn't commit to changing the government's policy. Instead, they say the province is committed to opening more care home beds and improving health care.
Folks who are in hospitals, I want to be really clear, are receiving care. You know, folks on the front lines are doing their very best to make sure that they're able to meet folks' needs, making sure that they're able to remain stable. I know that many folks across our healthcare system want to be able to provide more care.
Last week, Gordon Drawson finally got into the Lac du Bonny personal care home. His wife Margaret feels like she's won the lottery. It's only been a few days and already she's seen a big difference in him. Margaret was beginning to worry how she would make the drive to Pinawa in the winter. Now she doesn't have to, and she's grateful for that. Caroline Bargout, CBC News, Lac du Bonny.